So, very good afternoon, one and all. Today, I'm here, Dr. Aarti Singh, and I welcome you all in the ISFCP Dialogue Series. And today, we have with us our speaker of the day, Dr. Ram SAHU. He is currently working as an associate professor in the Department of Pharmaceutical Sciences, Hemvati Nandan Garhwal University, Bahuguna Garhwal University, Garhwal, Uttarakhand. And today he will deliver his talk on the role of artificial intelligence in transforming cancer research for improved diagnosis and treatment. So we welcome you, sir.
Thank you very much. Uh, Very good afternoon to everyone. I would like to thank Sri Parveen Garg, Chairman, Professor G.D. Gupta, Sir Director from Principal, Professor R.K. Narang Sir as a Vice Principal, and Dr. R.T. Singh for giving me this opportunity. It is visible now?
Yes, sir. Visible.
Visible now? Okay, thank you very much. So, uh, my pleasure to share my views about artificial intelligence. So today I will discuss about the what is the role of artificial intelligence in transforming cancer research for improved diagnosis and treatment. So as we know that this cancer is a very dangerous disease, and once the patients who are suffering from this cancer and he moved to third and fourth stage, then very difficult to save patient life. So now, as we seen that a number of different diagnosis, advanced diagnosis technique and treatment has been available, but still it is facing problem to control the death rate of this cancer patient. So, as we see that the International Agency for Research on Cancer, they estimate that globally there are 36 types of cancers are available. And they discovered that 1 in 5 people will develop cancer at some point in their life, and 1 in 8 men and 1 in 11 women will pass away from it. So around 8 million people die each year of cancer, and this cancer accounts for significant morbidity and mortality worldwide. It is also expected that there will be 30.2 million new cancer cases will be diagnosed by 2040. And if we see in our India the scenario of cancer, we see that every year incidence of cancer is increasing, and also mortality of cancer rate is also increasing every year. See, what is very uh, concerned about that we have to look on this. So now, if we see that different diagnoses, advanced treatments are available for the treatment of cancer. If we see that cancer, different advanced diagnosis are available, just like MRI, CT MRI, PET, CT, photo, acoustic imaging, optical fluorescence. These all are the different tools by which we can diagnose the cancer in any patient. And if we go for the treatment, the different treatments, traditional treatments available just like the chemotherapy, gene therapy, photothermal therapy, photodynamic therapy, radiation therapy. So these are the therapy. Apart from this, now in the era of novel delivery system, some new nanomedicines has been also developed. They use the targeting system. They use so the new different categories have been developed, but still they are facing problem to control the death rate of cancer. So there we have different challenges in cancer diagnosis and treatment. So if first is that uh, early diagnosis of cancer is very global challenging for us because we have not such a tool or applications that we can diagnose the patient in early stage. So if the patients can be diagnosed at early stage, the patient can be saved. The patient cancer of patient can be saved. So there may be the effective screening initiatives are limited by public acceptance, financial support, although treatment options for
Sir,
cancer.
sorry for the interruption. Are you changing the slides or not yet?
Yeah, changing and changing.
Uh, it is not visible here. Only we are like seeing first slide only. So you have to manually change. I think the slide. We are not able to see the slides.
Okay, okay, 1 minute.
Yeah. Now it is visible, sir. Yeah. Thank you, sir.
It is visible, madam.
Yes, sir. Visible. You can continue, sir.
Uh, okay. Now visible, madam.
Yes, sir. Visible, sir.
Wait, madam, wait. Hello. Take it. I changed slide, madam. It is changed or not?
Not yet, sir. You have to like change it,
Oh,
but
okay,
it
okay.
is
I
not.
see. Understand. No problem.
Yeah, with the help of
Okay.
cursor from 4 to 5. Yeah, yeah, yeah.
Yes,
Like
yes,
this, we
that I see
have
the
to
one.
change.
Yes,
Yes.
okay. Okay.
Okay, sir.
So, although the treatment options for cancer have expanded in recent decades, only a portion of previous patients benefit from the cancer drug, and the cost-benefit ratio of current treatment is suboptimal. This is the one of the challenges. Then, so we need some need to make cancer treatment more affordable and personalized. So after that, we have seen that develop a new cancer drug is time and resource intensive process because it takes long time for the development of new cancer anti-cancer drug, and it is also a huge amount required for developing this. Uh, then, even after a drug has passed preclinical testing and undergone clinical trials, the success rate is very low, and recruiting patients becomes very challenging. So it is the one of the other limitation. Then other is that so that other is that the human ability to process information is limited. There is an urgent need to implement alternative strategy. So this is the one reason because our brain is having some limited capacity. So whatever our capacity, our brain capacity, our scientists they are day by doing they are day by day developing some new diagnosis methods and treatment methods, but still they are getting failed to control. So now we have to take some other tools uh, help so that that tool can help the human being or human so that we can get the better diagnosis result or we can get the diagnosis at early stage, and we can also prescribe good medicine so that the patient can be cured early. So in this there is the tool available which is known as the artificial intelligence. This artificial intelligence can be described as a branch of computer science that deals with the simulation of intelligent behavior in computer. So, also it is based on computers following algorithm created by human or learned through computer method to support the decision or perform specific tasks. AI is the broad field of computer science in which machines or algorithms are programmed to simulate human intelligence. So basically, whatever we are having some programming in the computer, or we can say in machine, so that they can work like a human being. Whatever they are giving the order, they can follow and they can give their finding out. They can give their findings. So if we see this artificial intelligence, we find that this artificial intelligence, this tool can increase the accuracy of the result. Suppose whatever results we are come out from the pathological report, there will be chances that we can left out, or we have to miss some point or some data, so that we cannot find out the cancer or anything whatever we have to miss out. But in this case of artificial intelligence, they are very precious and accurate for the result. And also, if we go for the decision making, they are very perfect for decision making. And this artificial intelligence AI has the capability of solving the complex problem. If there is if there suppose data is very complex of any patient, this AI can easily resolve and easily can give the decision. So we can say that this AI has high level of computations. So this is the one of the thing. Then other is that if you go for the AI, if suppose you are going for different sectors, we can use for the AI. Uh, if you are looking for a diagnosis, if you go for a diagnosis by the help of AI, then finding new diagnostic method, biomarker, faster diagnosis, image recognition, symptom checker, decision support, these all can be done within a second. These all can be done within a second. So very less time is required for any diagnosis or reading of report of any patient. If you use in sector of therapy selection and generation, then this AI can recommend or prescribe new medications and treatments on the basis of findings, whatever the findings they find. Then drug discovery, you can use for drug discovery and developments, remote therapy, greater knowledge about rare disease. And now, especially for the cancer patient, pers- uh, personalized treatment is favored, because they are having, by this treatment we can reduce the adverse effect of cancer drug, because these traditional drugs are having lot of adverse effect. So this personalization for this personalization, so personalization of treatment, preventive advice, understanding of personal factor, these all can produce from this AI. So if they are prescribing the medicines, apart from this, they can also give some advice how to prevent, how to cure, or how to get better better treatment from this drug. So what are the things they have to avoid, or what are the things they have to follow? Everything this AI can suggest. And if you go for the prediction, suppose on the basis of report, whatever the report, pathological report has been produced. So, so observing that report, the physician can give the result. So they can predict this patient having cancer or not. So in this concern, this AI is very fast and very accurate decision they are giving. So pattern of recognition, predictions of risk factor and outcome, decreases prediction, greater understanding of causality. These all are better way understand by AI as compared to human, or as compared to any physician. Then public health, in respect to public health, digital epidemiology, national screening program, cost effective, the evidence driven regulation and policies. And in respect of administration and of operations, so automation of job, optimization of care pathways, demand and capacity, predictions, resource allocation. So these all different sectors are having different benefits to the patients. Then, so there's two terms are used in this artificial intelligence. One is the machine learning and other is the deep learning. So these are the basic unit for proper functioning and giving the accurate and precise data for this AI. So basically, what is the machine learning? Machine learning is a branch of AI in which computer perform specific tasks and apply statistical method to detect hidden pattern in data and improve the performance of models. So what we are basically doing in this AI, we are going to incorporate whatever data available, we have to incorporate in this AI. So this machine learning. So what suppose you have entered huge amount, suppose thousand, more than thousand lakh data. So these machines can read from that the available data present in database, and they can find out whatever the inputs, whatever the pathology report you have inserted in this AI tools, they can find out and they can read out and they can give the result. So basically, we are incorporating the data. So this machine learning also having the facilities, whatever the new, suppose you have inserted 1,000 data, but now you are again getting after 2 months, 3 months, you have again collected more than 500 data. Then again we have to incorporate this 500 data. So there is no need to require to delete or anything, so that this data also go on the same data and they can easily find out. So this way this machine learning is working. Then next is the deep learning. Actually, deep learning is a subfield of machine learning that employs mathematical algorithms using multi-layered computational unit that resembles human cognition. So this, so what we are doing, we are incorporating the artificial neuron, but we are producing the artificial neural network inside the machine. So this this neurons just like the human brain neurons. So that due to this deep learning capacity, this artificial intelligence has the capability to give decision, to predict, or they can predict and they give the decision. They can give the result. What and this due to this deep learning, what is the input you have produced to the data, same thing is produced at the end of at the end of study, because they can, because this whatever the neurons available, this neuron can help to read out and to help to match out the incorporated data or incorporated images, so that they can give the perfect result. Perfect means they give accurate and precise result, no neither to be any failure. But here we have to keep in mind that this AI can work only when we have to incorporate huge amount of data. Or suppose the data is lacking, then these AI are unable to give the proper response. There may be the bias in the result. So, so these AI especially work on the availability of data. So, so it is very important to incorporate huge amount of data. Suppose if you want to work on like the MRI report, so you have to, what we have to do, we have to take different MRI images of cancer patients and we have to incorporate it, so that our machine can uh, learn from that imported your MRI report, and that can correlate the patient MRI and they can give the results on the basis of that. So what deep learning they make this AI to give the decisions, to give the findings, what is the exact finding. So so deep learning operates on the power of multi-layer neural network, enables self-discovery of features that humans do not know or cannot anticipate. So So basically, AI is getting better at doing what humans do. So basically, they are doing what they are doing, but if you compare the efficiency and accuracy, they are more efficient and more accurate compared to women, compared to men, and also as we go for the costing, this AI can give lower cost. So the potential of AI in healthcare is enormous. Just as in our daily life, AI is increasing part of our healthcare ecosystem. So then next, coming this we are coming out natural language processing. So NLP is an adjacent field within AI that attempt to combine human language with machine interpretation. Because what is happening here, we are going to incorporate the data. Okay, suppose you have suppose AI has been incorporated or it has been integrated with the MRI machines. So now patients go under the MRI. Then what happens? These natural language process, what they do, they can give that whatever the machines, whatever the codings are there. So they can this by the help of this natural language processing, they can give the result in the form of readable or in the form of writing form so that we can understand the result. So this is the basically helping the NLP natural language processing. So it is used to transform unstructured data such as electronic health record, clinical notes, and diagnostic or procedure report to discrete data element. And also, this automation could support the development of complex database and tumor registries recursively increasing the power of the derived model. And also, we can do alone or in combination with the machine learning or deep learning technique. So if we can do in both the case. Now, why this AI is essential? So, if AI is essential for keeping us well, okay. So these technology applications and apps encourage healthier behavior in individual and help with the proactive management of healthy lifestyle. It puts people in control of health and well-being. So on this concern, we need this AI. Secondly, early detection. Early detection of cancer. As it has been reported that in American Cancer Society, the females, those who are having the breast cancer, by the by the physicians, they are having some, they are giving the false result. The result is like they found that every 1 in 2 healthy women breast cancer, but that was totally false. But they use the AI. So this AI are very accurate and precise. So they found that the number of patients in breast cancer in that America, it has been reduced because because this AI can give the exact result. Suppose the patient who are having this breast cancer, they are the only produce that they are having the breast positive report. Otherwise, those who are not having any type of cancer, they are giving a negative report. So this AI is very specific to recognize or detect the cancer. Now, in diagnosis, you go for the diagnosis. So in this diagnosis, we see that it are very useful for the early diagnosis. First is the second is that the technology combined machine learning and system neuroscience to build a powerful general purpose learning algorithm into neural network that mimic the human brain. Then in the case of research, we say that research, the if you see that 5,000, 6,000, suppose any drug registered for the preclinical trials, and you find that of the preclinical and clinical trial, the drug only 5 to 6 drugs come to market. So it is the only wastage of time and wastage of money. But these AI, by the help of these AI, we can reduce the time, and we can enhance the drug discovery process. So, so this AI is essential for this. Then next is how we can perform the cancer on AI. Suppose if you are looking for the do some research on through AI for the cancer, so there are different segments available that we will discuss. So if you see that researchers have developed tool to help with cancer identification and prognosis as a result of the ability of open source healthcare statistics to address problem in cancer medical treatment. DLM and ML model offer dependable, quick, and efficient solution on distributed data sets. For the analysis of distributed data, advanced predicted learning models can be deployed. So, detecting multi-cancer in whole blood using deep sequencing, virtual biopsy, and NLP to drive health histories from medical record, as well as advanced clinical decision support systems that incorporate genomic and genomic some of the new techniques that are clinically useful. So these tools can be used for the research. Now, what is that? This cancer totally work on the evidence base. Okay, so evidence based medical evaluations methods are widely used in oncology to assess cancer risk, diagnosis, disease, determine prognostic grading, deliver treatment, and track patient progress. So this can be done by the AI. Then again, the system started with a simple light microscopy observation. So, so if patients are going for the diagnosis, so by the help of simple light microscopy observation, their physician try to observe it. Then and after that, some more sophisticated advanced tool has been developed, like gene expressions assay, next generation sequencing of somatic and germline genome. These are the techniques by which we can diagnose the cancer. Also, AI has opened door to the synergic usage of drug for cancer treatment. So the future of digital healthcare and clinical practice is expected to shift the use of algorithm-based AI for radiology interpretation, electronic medical record, data mining to enable more precise cancer therapy. So looking on this digital healthcare system, this AI is very essential. So if we see so how basically AI cancer research works, so this AI cancer research works can do early and accurate cancer diagnosis. So in this, what we have to this can be done by the basis of computer-aided screening, sensor-based detection, biomarker detection, self-diagnostic application. So these are the tools which are available or which are integrated in the AI tool, so that they can give the result very fast. Then, for in case of predictions, AI we need that AI required to predict the results. What is the result on the basis of the data? So they can give cancer incidence, if patient having cancer or not. Then they can also predict that cancer is about to reoccurrence or not, and also they can give the cancer survival. So these three things can be obtained from this AI, and the results are very accurate. Then in the case of treatment, if we use for treatment, then we go for the drug discovery and repurposing, AI assisted surgery, AI go for the precision medicine, clinical decision support system, cell programming. So, so the use of AI in cancer research can be more effective if appropriate data are available to develop the model ML and DL. So these all segments can be worked out by the AI only when we have to incorporate sufficient number of data. So first thing we have to first thing we have to look on thing is that cancer data repository. So from where we have to get the data, because we are going to feed the images of the cancer. So uh, if you want to incorporate data of like pathological slides, if you want to incorporate data of like MRI, CT scan, whatever the tools available. So from where we get. So different agencies are available. From there we can take out data. From there we can extract out the data and we can feed into our application. So in this software, data technology and services are a part of digital health, which applies digital transformers to the health industry. So, according to Deloitte Insight, radically interpretable data and AI promise consumer focused and prevention oriented healthcare. So, ability of data is essential for data driven AI research, and many researchers develop frustration due to the lack of adequate data to carry out the research. So, there are some agencies like National Brain Tumor Society Clinical Trials Finder, National Cancer Institute Clinical Trials, Pancreatic Cancer Action Network Clinical Trial Finder, Sofnet Clinical Trial Navigation Service, Targeted Agent and Profiling Utilization Registry, the Leukemia and Lymphoma Society Clinical Trial Support Center. So these are the centers from where we can collect the data of cancer. Now in this repository, first part is that types of cancer data repository. Okay, so for this segment, computational analysis of cancer, a variety of data sources are available. So like electronic health record EHR, diagnostic imaging, pathology slides, and peripheral blood count. So these all data are available. Now, what the physicians are doing, whatever the pathological report, whatever the MI report, whatever CT scan, they are getting with them, and they can make it online, so that the researcher can collect data from there, and they can incorporate in their AI system. So then next is the radiography images. So from where we can get radiographic images of different cancer. Cancer imaging program is there. Cancer center is there. The, the cancer imaging archive is there. From these centers, we can collect the radiographic images of the cancer, so that we can incorporate in your database. Now, third one is genomic and molecular data. So if you want to collect the genomic data, gene data, whatever molecular data, then this can also be collected. So the cancer genomic atlas is there. Over 20,000 cancer samples from 33 different cancer types are characterized. The International Cancer Genome Consortium, here about 50 of the most significant cancer form its map and genetic flow. T-Bioportal data, genomic drug sensitivity in cancer, cancer cell line encyclopedia, linked omic. So these are the different energies. They are producing the uh, gene data online, and these are available on their site. Just we have to go and we have to collect it. Now fourth one is the pathological images. So nowadays, what the physicians they are collecting the whatever the pathological slides are available from the of the cancer patient. They can collect it and they can put on the website. So the whole slide image repository is available. Cancer digital slides archives are there available for the production of this type of pathological slides. Then fifth one is the clinical data and blood profiling. So data can is there. It is the cancer data knowledge one network that was co-created in order to produce better results and greater social benefit for the cancer research. So here you can get the blood related data and clinical data. Then Optum Oncology HR data. Optum data include vital sign, symptom, problem, descriptions, clinical evolutions, lab results, technique, diagnosis, surgeries, and therapies. Additionally, it contains information about the cancer stage, grade, histology, genetic mutations, other blood biomarker, lines of therapy, and assessment of the disease development and drug response for further increase its fullness to oncology. So these so so what we see that everything are available on online. So different centers are available. We have to approach them and we have to collect data and we have to go on the we have if you are going for the AI, so then you have to incorporate all the data in your AI tool and so that different programmings are available so that you can so by the help of the engineers they can set the program and your AI will be the ready for working. Now, so next is from where we can get the data. While others is using cloud data are available. So what now what the medical professionals are doing? Medical professionals across the world are exchanging information about disease diagnosis and management, drug response, strategies for managing disease and with patients. So whatever data they are getting, physicians, worldwide physicians, they are exchanging their data so that one physician can collect data and they can also go through and review it and so that it can help the patient or it can help the physician to give the result as fast. So moreover, such data might be automatically stored to cloud and utilize its computing power for discovering the insight with AI. Clouding companies essentially essentially the use of remote internet connected server which can be used to store and process data. AI platform allow the training of ML and DL model with wide range of customizing options. Cloud is very convenient for healthcare institutions to store massive amount of data securely, analyze them, and get useful insight. So this has led to establishment of tumor atlas. They made the tumor atlas. So here everything is available in cloud. Just we have to collect it. Now third sector is the AI for cancer prediction. So how this AI can predict the results in better. So AI powered predictive models are now an important part of cancer treatment. So predictive models can determine person likelihood of developing a particular type of cancer by identifying this factor. Before the disease break out, AI can identify those who are at high risk of developing it. So this AI can be early diagnosis. Then these allow medical professionals to keep a close eye on these patients and act quickly when needed. So patients can give more attention. According to researcher at the University of Hawaii, DL can distinguish between mammogram of women who later develop breast cancer and those who do not. This is a very good thing for the women because here they can because this AI can detect uh, women who are going to be a cancer or or having or not. So likewise, MIT researchers have developed a DL model for predicting cancer risk for mammogram images. Then, in order to better personalize treatment, regimen, a better patient counseling, prediction of overall survival, risk of recurrence, other outcome for cancer patient will be helpful. So these are things can be done by the AI. Fourth, for cancer diagnosis, the NYU Langeois Pulmotor Cancer Center started using their AI classifier for cancer diagnosis in October 2019. They made one AI classifier. So what is this AI classifier help? This classifier can help pathologists in diagnosis cancer more accurately, reducing hospital errors. So once where the pathologists are failed diagnosis, this AI are very good for detecting this one. AI-based cancer classifier can generally detect patterns that are too subtle for the human eye to recognize. This will help physicians to perform targeted cancer therapy for patients with improved outcome. These classifiers are normally trained using thousands of cancer samples, which could be much more than a single pathologist can see in a lifetime. Moreover, the machine will be consistent and will not be affected by inter-reader variability. This is one good important thing. Then, thus AI-based system can be used even by inexperienced radiologists to get clear diagnosis leading to the right treatment. So, because it's very good, this AI is very good for diagnosis purpose. Now we see the treatments. How the treatments are possible by this AI. So, according to researcher at MIT, sensor technology and Internet of Things (IoT) will collect a lot of personal data that can be used to create individualized treatment regimens. So, what better diagnosis will result, and AI and machine learning will be able to evaluate the vast amount of data and choose the first and most effective course of action. Then, the ability to use individual biology rather than population biology at every stage of a patient medical journey will increase effectiveness and speed of recovery when it comes to precision medicine. Because here we are going for the
Sorry,
individual.
sorry for the interruption, sir. We have limited time for the talk, that is 30 minutes. Try to sum up the presentation in,
Okay,
because we
no.
are already exceeding that time.
Okay, okay, no.
Yeah, just key points, or just highlight those key or
Okay,
important
okay,
points
okay.
in the presentation.
I
Yeah,
will take only 5 minutes. No. I will take only 5 minutes
yeah,
to
it's okay,
complete.
sir. Thank you, sir.
So AI can help physicians dose medicines safely but accurately. Here, AI could help with matrices and predictions, while IoT can help with sensor-driven data generation and analysis. So together with AI and IoT can optimize the safe drug delivery. So next is the so how AI impact on the cancer drug discovery process and potential of cost saving. So if we see that this AI technology based on AI enables the rapid and efficient development of novel molecules with desired property and activity. So here it has been also find out that by the help of this powerful algorithm, they can also sequence the proteins. Okay, so these protein sequencing can help the find out find out a new drug and also find out their effectiveness, so they can bring one revolution in the drug discovery. So by the help of this, we can do it. Now, next is how the this role of ML and DL predicting drug efficacy and toxicity of this cancer drug. So this AI are very precise and accurate for prediction of the efficacy and toxicity of potential drug compound. They can also identify drug-drug interactions, because now what we are doing, we are taking the combination of different drugs for the treatment of cancer. So that combination of drugs may give different efficacy to different patients, so that there is a chance of drug interaction. So these AI can recognize that drug-drug interaction, and they can alert the physician. No, this patient maybe have the adverse from this drug, so they can avoid the drug interaction. Then personalized medicines control the toxicity of drug, because we are prescribing personalized medicine, so we can minimize the toxicity of conventional drugs. Then other concern is that ethical considerations. So there is a ethical problem with this AI. Now regulatory officers are doing work to anyhow sort out this challenges and limits of the ethical consideration. So if we see the privacy here, privacy is very not possible, because every data are in the online, so anyone can read it. So this privacy can be affected here. Accountability: the team working with AI must own the responsibility of decision taking and the consequences. Safety: control over the data is being used and in what context. Then transparency. So, so here ensure compliance with the human morality, respect for human values, ensure sensitivity to different culture norms and values, fairness, no discrimination based on gender, race, caste, and creed. And other thing is that the bias sometimes we are getting biased result because due to unavailability of the data. So this is the one of the consideration. Now other is the challenges and limitation of AI. So the different challenges are there. Their discovery. So now it is very so now what is happening? So if we are going for the discovery, so there are challenges because this AI not can perform in the lab because the lab work, whatever the we are doing lab work, they are more accurate and they are more. So here what the basic thing the AI can enhance the efficacy of this laboratory work. So we have to anyway if we can integrate the traditional system of lab work and with this AI they can get the better result, accuracy and precision of finding. So if the data are limited, then you cannot get the accurate data and accurate result. So ethical consideration is the other things because there are lot of things which regulatory affairs can be sought out. So current AI based approaches are not a substitute for traditional experimental method. So we can also say that we cannot substitute the traditional experimental method. Now the conclusion. So, on the basis of this study, we said that AI could accelerate drug development process, increase efficiency and accuracy, and enable more effective and personalized cancer therapy. The effectiveness of AI in drug development depend on the availability of high quality of data, clarification of ethical issues, and recognition of the limitation associated with AI method. The growing interest from researchers, pharmaceutical companies, and regulators combined with the potential benefit of AI, make this an interesting and promising area of research that will transform drug development. So, so this the AI can be work as a very fast and they give the very accurate and precise result. So anyhow, we have to incorporate this AI with our traditional experimental so that we can get a better result. Now, thank you.
So, thank you very much, sir, for enlightening us with your expertise. And it was an amazing lecture and discussion. And I hope the knowledge shared by you will definitely help the student to gain the knowledge in the area of artificial intelligence along with the cancer research. So, thank you very much, sir, for giving us
Thank
your
you.
valuable time. We really appreciate that. Thank you very much.
Thank you.